Good morning, everyone. I'm very happy to have the chance to talk about my PhD work, which is the role of various physiotherapy modalities in the treatment of pelvic pain syndromes. My name is Gökçe. I'm a full-time PhD student at Semmelweis University. I believe pelvic pain will be alleviated with the knowledge of advanced physiotherapy methods. My mission is to enhance the quality of physiotherapy treatments for patients, resulting in better patient outcomes and overall well-being. Currently, we have two ongoing projects. Both of them are systematic reviews and meta-analysis. And the title of our first project is Investigating the Effectiveness of Physiotherapy Methods in Women with Endometriosis-Associated Pelvic Pain. Endometriosis affects more than 190 million of women of reproductive age. And among these women, infertility and/or pelvic pain ratio is as high as 35 to 50%. And physiotherapy techniques might be efficient in the treatment of endometriosis by reducing inflammation, relieving pain, and thus improving quality of life. We have various physiotherapy techniques for endometriosis-associated pain, such as exercise, manual therapy, or physiotherapy modalities like electrotherapy and laser therapy. And with this project, we aim to investigate the effect of physiotherapy methods in relieving endometriosis-associated pain. Accordingly, we wonder, are physiotherapeutic interventions effective in improving pelvic pain in patients with endometriosis? We choose our population as women with endometriosis-associated pelvic pain with the intervention of physiotherapy techniques compared to non-physiotherapy techniques. And our outcome is pelvic pain change, and our hypothesis is physiotherapy techniques have the same or superior effect compared to non-physiotherapy techniques in the treatment of pelvic pain. We conduct our systematic search in three major databases, Embase, Medline, and Cochrane. We use two domains, population and intervention, and we ended up with 8 eligible full text. And here in figure 1, we see that if we plot the change in pain score from baseline to follow-up, this plot provides no strong evidence about the time-effect relationship. And due to that, we were able to pull all studies together. And figure 2 displays the pain score from various studies comparing the control and intervention groups at baseline, follow-up, and change. In the baseline panel, we see that pain scores started in the similar levels, and the follow-up shows that the pain score after the intervention period, and it's visible that intervention methods were able to reduce pain further. And the change plots compares the control and interventions reduction of pains, and if we check this panel, we can see that pain ranged from 0 to 3 in the control group, while it was ranged from 2 to 6 units of change in the intervention groups. And in this first plot, we investigate the women with endometriosis-associated pelvic pain. We included studies with the intervention of 3 physiotherapy subgroups: exercise, manual therapy, and physiotherapy modalities. And we compare them to non-physiotherapy techniques as placebo or the control groups. The heterogeneity of this study was moderate, and it's due to including and comparing the various techniques, and the sample size was small, and the difference in pain reduction between control and intervention groups can be seen in the MD column, and the pool effect shows that pain reduction in intervention groups were about 2 units further than the compared to control groups, with the p-values smaller than 0.05. And in summary, this plot provides a clear evidence that physiotherapy modalities were able to reduce pain compared to control groups, both in clinically relevant and mathematically significant results. After finding out the efficacy of physiotherapy techniques, we wanted to find out the most effective physiotherapy technique. And as a result of our analysis, all intervention groups were beneficial from the aspect of clinic. However, the physiotherapy modalities were the most effective methods with more than 2 units of reduction in pain and a p-value smaller than 0.05. And lastly, regarding the application sites, among 7 studies, 5 used locally applied and 2 used generally applied techniques. And as a result, this plot provides a clear evidence that locally applied techniques were more efficient in the treatment of endometriosis disease. And as a conclusion, physiotherapy techniques effectively decrease pain, especially when locally applied techniques are used. And among these methods, physiotherapy modalities are the most efficient methods. And we strongly suggest clinicians who are treating endometriosis patients to include physiotherapy techniques into the therapeutic options. And more research is crucially needed with larger sample sizes and with or without additional drugs. Regarding the progress of our first project, we finalized writing our manuscript as a draft. However, we need to update it after completing the grade assessment. And in detail, half of the manuscript is under the review of my supervisors, and I will be sending the other half in the following days. And we aim to submit this draft to internal review by July, and our aim is to publish this article in BJOG. And please allow me to talk about my second project, investigating the effectiveness of physiotherapy methods in women with menstrual pain. Menstrual pain, dysmenorrhea, affects 50 to 90% of women worldwide. And this pain heavily impacts women's quality of life, productivity, and focusing ability. Currently, usual care mostly focused on pharmacotherapy with the prescription of NSAIDs. However, these medicines have some side effects from headache to cardiovascular diseases, with some contraindications such as kidney diseases, stomach ulcers, and they can cost more than $100 per month. Accordingly, there is a need for exploring the innovative and effective treatment methods. And physiotherapy techniques are excellent therapeutic additions and/or alternatives to the standard care, as they are non-invasive, they are cost-effective, have low risk of side effects, and they help to reduce the pain intensity and the duration. And our aim is to assess the most effective physiotherapeutic treatment in reducing menstrual pain to improve women's quality of life. And our clinical question is, do the different physiotherapeutic approaches have diverse efficacy in relieving menstrual pain? We use PICOS framework, and our population is women with menstrual pain, with the intervention of various physiotherapy techniques compared to physiotherapy techniques, as we aim to conduct a network meta-analysis. And our outcome is pelvic pain change, and we want to include only randomized controlled trials. And our hypothesis would be various physiotherapy techniques might have different efficacy levels in reducing menstrual pain. And our clinical implication to apply the most effective physiotherapeutic approach in reducing menstrual pain. We conduct our preliminary research in the same three databases. We ended up with almost 3,000 of citations, and we used three domains, which are population, intervention, and study design. And we aim to submit our Prosper registration by July. In summary, we have two ongoing projects. Both of them are systematic reviews and meta-analysis, and we aim to submit them by July and December this year. And I would like to end my presentation with an inspiring quote from Fatih Sultan Mehmet: "To see the limits of the possible, one must attempt the impossible." Thank you for your kind attention and your time as well.
Thank you very much for the great presentation. I have a question related to your first project. You mentioned that you would encourage researchers to continue this theme with further studies. So what kind of studies would you recommend for further research?
Well, thank you for your question. To be honest, we were struggling finding articles during this meta-analysis. So any kind of studies would be helpful for our field. However, especially we need studies with larger sample sizes and with longer follow-up times, and also with different intervention types as well.
Thank you.
Thank you for the nice presentation, Gökçe. It was very nice to hear all this progress. I have one question regarding your first project. Can you name us a few examples, like which techniques are the most promising, the most interesting in your opinion? Which techniques you would like to, for example, practice later if you have the possibility?
Thank you for your question. Well, as a result of our project, we realized that advanced physiotherapy techniques or physiotherapy modalities are the most effective methods, and I think they are really promising, so I would like to apply my patient these methods, for instance, electrotherapy or laser therapy.
Thank you.
Thank you, Gökçe, for your nice presentation. I have a question because I think you have finished the discussion section, so I would like to know, is there any clear mechanisms to support this physiotherapy can reduce the pain in your article, maybe?
Well, can you specify a little bit more?
For example, how the physiotherapy can reduce the pain.
The mechanism of the, okay, thank you for asking. Well, it depends on the technique. If we continue to talk about the most effective methods, for instance, electrotherapy used the gate control methods for the release pain, and we basically, with the electrotherapy, block the pain receptors in the central nervous system, and by that way, patients do not feel the pain, and it's the most effective method with the shortest treatment time.
Congratulations to your presentation. I would ask a question regarding to your first project. Maybe you mentioned, but I don't remember that how did the articles measure the pain?
Well, thank you for your question. It was just written, so it's good to ask. Well, articles use the visual analog scale or the numerical rating scales, which are the pain measurement scales from 0 to 10 points. And it's basically a scale that patients just sign their pain score, and they apply these measurement scales before and after the interventions.
Thank you.
Thank you.
If there are no more questions from the audience, I have one question.
Oh, okay.
Endometriosis is a disease from the 4Ds, like dysmenorrhea, dyspareunia, dyschezia, dysuria, and the chronic pelvic pain. What do you mean? Could you make from the study groups to make subgroup analysis to see which of the pain type could be the best decreased with physiotherapy techniques, or are there any data about this selection of pain types?
Well, our second project is related to dysmenorrhea, so maybe in the future we can create another study about that, but for now we just want to focus on these two projects, and if we see and if we find out the effectiveness, then maybe in the future we can do these subgroups too.
Yeah, that would be interesting. What type of patient-related specific therapies? Thank you for your excellent presentation, amazing work, and
Thank
we
you
are
so much.
asking.